All right. Hello, everyone. Welcome to our training today. This training is presented to you by the Westchester County Continuum of Care Partnership to End Homelessness, as well as the Westchester County Department of Community Mental Health. And the particular unit that's going to be presenting this training today is the Developmental Disabilities unit. So today we are here to talk about and to also share information about how to navigate eligibility, services, and supports with the New York State Office for People with Developmental Disabilities. And I'll go ahead and let Matthew and Michelle introduce themselves.
Good afternoon. My name is Michelle Armisto. I'm the Program Coordinator of Developmental Disability Services here at Westchester County Department of Community Mental Health.
I'm Matt Faulkner. I'm the Community Work Assistant. Michelle and I are the unit of two here in our department, but we collaborate together as a department, even though we're in various units. And my work entails providing Westchester families with assistance with the OPWDD eligibility application, as well as identifying students who are transitioning out of the Westchester County school districts to adult services.
Okay, I guess I'll start off. First, I want to thank Jenny for coordinating the training. From the turnout, it appears that the topic area is certainly of interest. My colleague Matthew Faulkner and I are going to talk a little bit about what developmental and intellectual disabilities are, provide specifics about the New York State Office for People with Developmental Disabilities eligibility process entails, and briefly talk about services and supports that are available to individuals with OPWDD eligibility. Since we have a limited time, I would ask that you hold your questions to the end of the presentation or type them into the chat, and we'll try and get to as many questions as we can at the end of the training. And if some reason we don't get to the questions, we certainly can respond back to questions that are left in the chat. So, intellectual and developmental disabilities, I just want to give a brief overview. They occur among all racial, ethnic, and socioeconomic groups. They're conditions that occur between birth and age 22. They're expected to last indefinitely and cause significant deficits in adaptive behavior. The term developmental, what is the difference between intellectual and developmental disabilities? It's really the term developmental disabilities and intellectual disabilities have two very different meanings. A developmental disability may encompass an intellectual disability depending on the condition. An intellectual disability describes someone who has below average cognitive abilities and significant limitations in the ability to adapt and carry on everyday activities such as self-care, communication, and socialization. The developmental disability is a lifelong disability that can be cognitive, physical, or a combination of the two. Just a couple of things. Some think that if an individual has a developmental disability, they also have an intellectual disability. However, that's not always accurate. An individual can have a developmental disability and not an intellectual disability. To give you an example, someone with an autism spectrum disorder may have average or above intelligence. However, they may have significant adaptive behavior deficits. Also, just to remember that just because for this training, we're talking more about OPWDD eligibility, but I want people to remember that just because an individual has an autism diagnosis, it does not automatically mean they will meet the criteria for OPWDD eligibility. So I just want you to keep that in mind. You want to change next slide? The first section of the slide is it's the most common developmental disabilities, and you can see it's, you know, intellectual disabilities included, autism spectrum, cerebral palsy, epilepsy, and seizure disorder, a number of neurological impairments, Prader-Willi syndrome. And, you know, the abilities, individuals' abilities may vary in, you know, all of those areas: communication, the ability to understand, the ability to act independently, the ability to make choices, or, you know, the ability to, you know, perform their daily living skills. So there's not two people that will look exactly alike. Next slide. Matthew is going to now provide some more specifics about what OPWDD eligibility process entails.
Thank you, Michelle.
Sure.
So the importance of determining eligibility is so that individuals can access the services that OPWDD provides. And as Michelle was saying, OPWDD has certain criteria that they look at in order to determine eligibility. So the applicant has to have a documented developmental disability or a qualifying diagnosis. So this is the first of the criteria. It's not all of the criteria. You have to have all 4 of these listed here. And so it's very important that the disability be documented. You know, sometimes people will say, well, I suspect that this person has a developmental disability. Well, that's good, but you know, you also, it must be documented by you know, a specialist. Second, the qualifying diagnosis occurred before the age of 22. So, for example, if, as Michelle was saying before, traumatic brain injury is a neurological impairment, and if someone, for example, is in a car accident and has TBI, but they're age 26, they would not be eligible for OPWDD eligibility since it's before the age of 22. The third criteria is that the diagnosis is expected to continue indefinitely, so that there are going to be no changes, you know, as far as the diagnosis is concerned. And then the last criteria, you know, is very important, as Michelle was saying, that prior to the age of 22, the diagnosis caused substantial deficits to the applicant's adaptive functioning. So please keep this in mind, that even though someone, you know, maybe have, you know, autism spectrum disorder, for example, but they don't have substantial deficits to their adaptive functioning, they, you know, would not be eligible for OPWDD. Or if an individual has mild epilepsy or seizure disorder that's controlled by medication, and it doesn't impact their functioning, they would not be eligible for OPWDD. So the disability has to impact the functioning of the person. So you have to keep that in mind. And OPWDD looks at all 4 of these criteria, and all 4 have to be present for eligibility. Is there an age limit? There is no age limit to applying for OPWDD eligibility. So it can be a child, it can be an adolescent, it can be an adult over the age of 22. So just to give you, you know, some information here, you know, we track in Westchester County. Specifically, what we do here in our department in terms of eligibility. And I would say almost half of the people applying are children under the age of 12 and adolescents as well. We do have adults applying, and sometimes the adults, can be in their 60s, in their 50s. The parent has, they've always lived with the parents. The parent never thought about applying for OPWDD eligibility. And now the parents have, illnesses or can't take care of, their son or daughter anymore. So, so people who are older, over the age of 22, adults, and specifically, we have gotten, several people in their 50s, 60s, applying for eligibility for the first time. Next slide. So there is something called provisional eligibility, and provisional eligibility is for children under the age of 8 who apply for eligibility. They can get provisional eligibility, which means it's for a limited time period. There are some children who apply that get permanent eligibility, even though they're under the age of 8. But there are some that get provisional eligibility because there could be some changes during that time. And if a child gets provisional eligibility, then at age 8, they will have to apply for what's called regular eligibility or permanent eligibility. The process. So I'm just going to speak to, we have many options out there for people applying for eligibility. We are one of the options of, providing assistance to Westchester residents for applying for eligibility. And so the process really entails completing a registration form and providing the documentation that OPWDD requires so that they can make a determination. It is also based, on if the individual is a child, of course, we're going to need to have the consent of the parent guardian to initiate the process. So it's a voluntary process. Nobody has to apply. But again, remembering the importance of why people apply, it's because individuals could be receiving lifelong services if they're determined eligible. The documentation, I know, some of this may not be as important to some of you, but you should be familiar with the evaluations or the documentation that OPWDD requires. So there are 4 evaluations that are required for everyone who is applying for OPWDD eligibility. The first is a medical assessment or a physical evaluation from the individual's doctor. I have here completed within 10 months, but it's really within 1 year. But I put down 10 months because sometimes, when evaluations are handed in, and by the time OPWDD reviews them, they could go out of compliance of that 1 year period. So that's why I put 10 months down. Next slide. The second requirement is a standalone comprehensive psychosocial and developmental history completed within, again, I put down 10 months, but it's 1 year. That includes information on the pregnancy, birth, and neonatal period, developmental milestones, and significant events in the person's life. presently. So this is an evaluation that should be completed by a clinician. So not a family member, not, you know, a neighbor. It should be completed either by a social worker or psychologist who interviews, you know, the parent or whoever the individual is that's applying. Third requirement, a cognitive evaluation. So there's some test measurements that are there. You know, those are some examples, but it should be a full scale evaluation and not an abbreviated measure such as a WASI or a KIBIT. These are not acceptable to OPWDD. Now they can go into, there's many different things here that follow. I'm not really gonna spend too much time on this, but for applicants who are not fluent English speakers, tests published in another language can be used, okay? Tests which are translated by the test administrator or another person are not acceptable. For applicants who are nonverbal or have expressive or receptive language impairments, hearing impairments, or for those for whom there is not a test published in the language they speak fluently, there is a nonverbal IQ evaluation, such as a C-TONY or a leader. And they, you know, for anyone in this category or who have these impairments, the psychologist should use one of those test measurements, along with the performance measures of another test, which is listed above. And there is such a thing that if an individual is judged not testable after more than one attempt is made and evidence from the test setting is documented in the full behavioral description, OPWDD will take this into account. So, so the test has to be at least attempted, and the psychologist must write up the reason why the test could not be administered. Next slide. And then the last requirement is, again, remember going back to the beginning of the presentation, we said the disability impacts the functioning of the person. So there's standard measures of adaptive functioning. The most common are Vineland-3 or ADAS-3. And usually a person who knows the individual well, so like a parent, an advocate, a guardian, you know, on the side of the parent. And, you know, if the individual's in school, you know, usually a teacher would be another, an informant who complete a survey of questions that the psychologist gives to them. The questions focus on socialization, communication, adaptive life skills. And then the psychologist will score each of the surveys by the two people completing them and will write up an interpretive report. So additional documentation, if the individual happens to be in school, a current IEP, any current service-related reports like speech, OT, and PT can be good supporting documentation. They're not required, but if they're within 1 year, you know, you can present those reports as well. And for individuals on the autism spectrum, OPWDD is asking for a comprehensive report from a specialist. For example, a developmental pediatrician, pediatric neurologist, child psychiatrist, psychologist. And the report would not only state that the individual is on the spectrum, but the specialist should provide the reasons why the diagnosis was given. Specific behaviors or symptoms that the individual displays of the diagnosis, some developmental background of the diagnosis. If the individual has more than one diagnosis, which is primary. So that kind of report they're looking for. Or, next slide, there is what's called an autism-specific assessment, such as an ADOS, which is an Autism Diagnostic Observation Schedule, or ADIR. These can be acceptable as well. And the focus of these, it shows where the individual falls on the autism spectrum. And it also includes some specific behaviors and symptoms that the individual displays. So either one of those are acceptable. A screening instrument such as the GARS, sometimes you'll get, the schools will do CARS or GARS. These are not acceptable by themselves, but they can be, provided, but with another assessment, as I mentioned above. For anyone with, cerebral palsy or epilepsy, any kind of neurological evaluation, would be good to submit. If someone has Down syndrome, they may have genetic testing. Down syndrome is not a developmental disability, but most individuals who have Down syndrome usually have an intellectual disability, which that would be the qualifying diagnosis. But if a person is Down syndrome, they can provide genetic testing. For anyone who's over the age of 22, sometimes this is where it gets very tricky. That an older individual who's out of school, hasn't been in school for many years, they may not have documentation supporting their disability or their adaptive functioning before the age of 22. And this is where, it gets tough for individuals who are in their 50s and 60s that we're working with. If some of these evaluations can't, be found, or they don't have them, then somebody who knows them well, usually a parent, a guardian, advocate, could even be a neighbor, who knows them well for many, many years, would write a narrative of their adaptive functioning before the age of 22. So, for example, how was this individual different from a typical kid of his or her age? Or how, and OPWDD does provide specific themes in regards to different deficits that you can, that we would, provide the person writing the narrative to include. When is the best time to apply for OPWDD eligibility? If their person is in school, usually at reevaluation time. So that's when they're updating all of the documentation or evaluations. When can a packet be sent in to OPWDD for determination? When a packet is complete. And that's part of my job, to make sure the packet is complete. And then once it is, I would then send it to OPWDD. Next slide. A determination is usually made within a 3-month period. It can be much faster than that now. I would say in about a month, determinations are made. Now, if the packet is complete. If the packet is incomplete, and they're asking for more documentation, it can certainly take some time. Sometimes OPWDD may ask for a face-to-face, or, these days by video conference, and, they would like to meet the individual who's applying. Here's before I mentioned in the beginning who can assist with the OPWDD application. Of course, our department can do that. And care coordination organizations that Michelle will speak about in a few minutes. There are 4 of them in our region who also can assist. There are some not-for-profit agencies in Westchester that can assist. Westchester Institute for Human Development, Westchester Jewish Community Services, and ARC of Westchester. OPWDD contacts, these are the 2 contacts, psychologists who are in the eligibility office, who I speak to very frequently. And I just want to let you know that they have now regionalized this process. So when I send a packet to OPWDD, we never know who's going to be reviewing it. The reviewer can be from another county. It would be from our region, but it could be from another county. So I know all of the reviewers by now. And if we have questions, I always contact them. And Michelle did mention the front door before. Usually that's where people begin the process. They call the front door number, and they send them a welcome packet, and then they point them in the right direction as far as going through eligibility, and so that is the eligibility process.
I guess next slide. Okay, so as Matthew explained the eligibility process, I'm going to go into a little bit about what services and supports are available to individuals who become OPWDD eligible. But I just want to make a note for, since majority of the people on this training today are shelter workers, that most of the services and supports that are listed on the slide are not available to individuals residing in homeless shelters, as OPWDD considers that an ineligible setting. However, that should not stop people from applying for eligibility, because the hopes are that people will move on from homeless shelters. And housing is one service and support that I'll talk about in a couple of minutes, that the hopes are is that could assist individuals exit homeless shelters. Individuals with intellectual and developmental disabilities exit homeless shelters a little bit quicker. So I first want to talk about care coordination organizations. As Matthew had indicated, there are 4 care coordination organizations that provide services and supports in Westchester County. I guess, can we move to the next slide? No, hold on 1 minute. I think the next slide is, yes, if you could move to the next slide, that'd be great. I did provide some handouts, which I think that Jenny will be sharing at some point, that give the contact information for the care coordination organizations. There's some family support service directory that we're going to share with the group that has a lot of resources. Some the resources can be accessed without having OPWDD eligibility, such as supports with the eligibility process. Those contacts are on that as well. So there are 4 organizations that cover Westchester County: Tri-County Care, Life Plan, Care Design, and Advanced Care Alliance. All four of the, we'll call them CCOs, all four of the CCOs have, I guess what they call Care Connect teams that can assist individuals, walk them through the eligibility process. All of the supports and services that OPWDD offers, individuals need to first go through eligibility. So that was a big piece that Matthew just went over with everybody. So that's, that's certainly the key piece in services and supports through OPW. Care management services, pretty much are what they are. They're, supposed to be person-centered. We can, help meet the needs of the individuals, make sure individuals are getting services. They can help coordinate access to behavioral health, medical, dental, identify community resources to help to connect to care providers. With regards to the eligibility piece, they can help individuals with scheduling appointments for needed evaluations, gathering documents that, all the documents that Matthew talked about, they can also assist with in the eligibility phase of working with that individual. Once an individual is found OPWDD eligible, they would likely want to choose one of these four care coordination organizations to provide the care management services. Next slide, please. Okay, housing. OPWDD offers both certified and non-certified housing. I probably the most, the certified type would be, most people know as group homes. OPWDD considers them individual residential alternatives, or IRAs. There are a couple different types, 24 hours supervised and less than 24 hours supervised. Housing supports within OPWDD is really dependent on the level of care an individual would need, supports they would need to be able to live as independently as possible. They do offer housing subsidies. They are for individuals who can, pretty much live independently with some supports, but they have to be, the individual would have had to have already applied for Section 8 and, any other housing type subsidy supports. And then if found that they were not available, then OPWDD could provide a housing subsidy for folks. Also, there's family care. Just also to know, OPWDD does not provide housing for children. So if you have a family that's in a shelter and the individual who's identified with a developmental or intellectual disability is a child, OPWDD does not provide housing supports for the child. It's the family's responsibility to provide housing supports for their children. Next slide, please. I'm going to talk about a couple of other services. I know that we're limited on time, but OPWDD services are paid for by New York State and the federal government, with a majority of the services being provided through the home and community-based waiver. Community habilitation is one of them. A lot of individuals who receive housing subsidies also receive community habilitation, and that really helps the individual, live as independent as possible. But not just individuals who receive housing subsidies can access community habilitation. We have children who receive community habilitation, and they really work on a variety of life skills, really just dependent on what the individual's needs are. It's certainly it's supposed to be a person-centered service, just to assist the individual become as independent as possible. Examples could be helping with community inclusion, relationship building, development of social skills, travel training, money management, appropriate behavioral development to help the individual access their community. One of the other home and community-based waiver services that is very popular is respite. It's also Medicaid funded, and it provides relief to the people who are responsible for the primary care of the individual. People, respite could mean in-home respite, could mean camp, could be a recreation program, could be some providers have site-based respite programs. Unfortunately, as I said before, the home and community-based waiver services are not, they're not able to be provided in the shelter setting. Next slide, please. So the PowerPoint slides will be shared with the group. Jenny, I think, is going to share those. Both Matthew and my contact information is on the slides here. I want you to please feel free. It's a lot of information that we gave you today, but I want to make sure that you feel, know that you could reach out to us with any questions or concerns, want to talk over, a particular case, run something past us. We're more than happy to do that. We would suggest that anybody that really wants a little bit more information on the OPWDD service system to attend one of the OPWDD front door information sessions. That link is also on the PowerPoint slide, so you certainly can do that. They're virtual. They run them, I think, a couple times a month. I do think they also offer them in Spanish. Next slide. Questions. So we can open it up to questions.
Michelle, there was a question in the chat about if DV shelters are included in that, in terms of that it's not an appropriate setting or not an eligible setting. Would that would include DV shelters as well, right?
That's what I've been told.
And my follow-up question is, how about transitional housing? So we have, like, for families in Westchester, we do have a transitional program where they are in what we call an EHAP, which is Emergency Housing Apartment Program, where they're in an apartment in the community. It's still, by HUD's definition, considered a type of shelter, but it is their own apartment in the community. Would that be an okay setting?
Are they receiving supports and services in that setting?
I would say minimally. They do have, they're connected to a service provider, but it's really about housing, not about anything else.
Okay. I will have to be quite honest, I will have to get back to you with an answer on that. I would probably have to say that it's probably going to be the same, but I don't want to give you, misinformation. So I certainly can get back to you with that answer. Are there any other questions?
I have a question about basically how do we bridge the gap for people who are adults and are experiencing homelessness, single adults. And the reason that they're homeless is usually they don't have those long-term contacts or supports, like that neighbor that could narrate their lives. Is it possible that that person could use multiple sources to put together their lifelong narrative, like, a neighbor who knew them when they were growing up, or maybe a teacher from school, or, we would really be needing to shake the bushes to find a narrative for a lot of the people that we serve.
Sure, that's a very good question. Yes, to answer your question, somebody who knows the individual well, if there's no prior assessments, before the age of 22. So anyone who knows the individual well, certainly can, complete a narrative.
I also want to note that when families are completing the forms for the assessment for the for an adaptive behavior assessment, we always tell the families that they really should report on the individual on their worst day, not on their best day. We as parents like to, show the best in our children, but they really want a good picture of how the individual functions on their worst day.
And Michelle, if we're working with an adult, and let's say we find out that they have had either CPSE or CSE involvement during their education, is there a way for an adult to access their own records through the school district?
There is, but usually school districts only keep records for a certain length of time. It's usually, I think, 5 to 7 years. So that's when it becomes more difficult for individuals who are older in applying if they don't have, some kind of records prior to age 22. So, but yes, they can access them through the school district. And if the school district has them, they can certainly request them.
We're certainly here to assist. If you have, if you encounter someone who you think may have a developmental disability and you're really not sure whether or not, or they're not able to, tell you whether or not they ever applied for OPWDD eligibility, you certainly could reach out to Matthew or myself, and we certainly can check to see if the individual is already in the OPWDD system. We've come across that quite frequently, just say within the hospital systems, where they get, where a patient comes in and they suspect a developmental disability, and they reach out to us, and we're able to check and see if they're already connected. And sometimes they are, and sometimes they already have a lot of services and supports in place, but maybe they have disconnected from their care manager or services, or for some, for whatever reason, they enter the homeless shelter system, but they may already have gone through the eligibility process. So certainly feel free to reach out to Matthew or myself, and we can certainly look into that.
I think it's important, as Michelle was saying, you do have contacts here, Michelle and I, if anything, you can always call us, contact us, and we'll do our best to, help you, assist you, or the family or an individual.
Hi, I have a client with a 3-year-old child that's Down syndrome. What would I tell her she should be doing as her first step to find out if the child is eligible for OPWDD?
Okay, so usually children with Down syndrome more than likely have the qualifying diagnosis of an intellectual disability. Not everyone, but most, and that would be the qualifying disability for OPWDD. So in terms of being 3 years old, they can begin the process of applying. And what I went over, in terms of the documentation, the first four of those documents are needed for everyone to apply, would apply in this case as well. And again, we're here to assist you with documents. As far as what documents are needed. Sometimes individuals have a hard time of obtaining documents, even from the school districts. So we do have places where we can send individuals, not so much children, because they're really in the school, and school should be providing those documents. But, for older people who may not have like current evaluations, we would send them to certain places to get documentations if they need it. So to answer the question, age 3, they should begin the eligibility process, and they can do that now.
So could that mom contact you, Matthew, for a 3-year-old, or would she start at like the CPSE level, or what's the best, her
She,
best?
contact me, or she can go through the CPS, E as well, because they would probably have, the documents that she needs. But as a first contact, I could work with her, to make sure that she obtains the documents that are needed. And I could, assist in helping her complete the application if she needed it, anything like that.
Mom should also consider, because at some point she'll have to attend a OPWDD front door information session. And that the link for that is in the PowerPoint slides. So she might want to think about that as well. I see in the chat there's a question: is there a liaison between DCMH and OPWDD? Matthew and I can certainly act as the liaison. We are DCMH, so we have very close contacts within OPWDD. So if there's anything that's needed, you certainly can reach out to either Matthew or myself.
Thank you so much for the information. It's been wonderful. I know that it's quite a process to gather all the information to put in an application. So when individuals are lucky enough to finally be able to get to the position where they can submit an application for review, how long can we expect for the review process to last?
Well, depending on, again, ensuring that the packet is complete with all of the documentation needed. If it's not complete, I would, if they're sending the packet to me, or I'm assisting the family, I would request, documentation that is missing. That OPWDD requires. So that would be the first step. But once a complete packet is sent to OPWDD, they, depending on the evaluations that are there, they could ask for something additional. Perhaps they read in a report that there is another report that they would like to look at. Or it could go to what's called a second step review, which means that more clinicians are looking at the information that was presented. Sometimes parents will get a letter from OPWDD saying that the packet went to a second step, and they think that means that the individual is not eligible. No, that doesn't mean that. It just means that more clinicians are looking at the information, and perhaps more documentation may be required. So, you know, and we work with the eligibility team very closely. So if there were ever any questions, you know, I've advocated, you know, for individuals where they're asking for something that, you know, could be included or was included already, but, you know, so we're advocating also on behalf of the family, you know, applying in terms of documentation and even, you know, contacting the school districts. I mean, each district has a certain way of, you know, releasing documentation, you know, providing consent. You know, some school districts, they have outdated information for individuals, whether that's because the district is so large and there's so many individuals, you know, so, you know, we will do our best to try to, you know, help the individual as far as, you know, making sure packets are complete. It can go through a 3-step process, Lindsay. Besides second step, there's another step. If the individual was determined not eligible, there is an appeal process, which I always encourage parents or individuals applying to appeal. And there is the appeal process is written on the determination letter, but again, you know, if parents or have questions about that appeal process, they can contact us and we can, you know, provide them with the information. Many people, you know, have appealed and they have reversed their determination. And sometimes the appeal process does, they ask for a video conference or face-to-face contact with the individual and the parent. Now, before COVID, they were asking them to go to the eligibility office for that face-to-face, but because of COVID, they are doing most of these video conference. I hope that answers your question.
Yes, it's always a case by case
Right.
situation.
Case by case situation, right?
But you would say, like, if it was a complete application and all went well, what would be a time frame? Like 1 to 3 months, 3 to 6 months?
If somebody is clearly has a developmental disability and substantial deficits in their adaptive functioning, it could take a week for them to determine that this individual is eligible.
Great, thank you.
Yeah, I mean, I just handed in the packet clearly a child who met all of the criteria and they determined the child eligible in less than a week.
Yes.
But it's the, you know, it's gets more complicated when, you know, again, like, you know, for adults when it's hard to get prior documentation or there are questions about whether this individual has a qualifying condition, you know, or sometimes a person's adaptive assessments are above the criteria for OPWDD eligibility. So there could be lots of reasons sometimes why individuals are determined not eligible. And if an individual is determined not eligible, they can always reapply as well. So we've had people reapplying for eligibility, but it's reapplying with all new documentation. than the first time they applied.
As Matthew spoke about earlier, it does get a little bit more challenging when an individual applies after the age of 22 and has no documentation of the developmental disability prior to, but it also becomes a little bit more challenging. And I've seen with OPWD when there is also, in addition to a developmental disability, there's a psychiatric diagnosis as well. So there, OPWDD, may take a little longer in that process because they really need to be able to figure out if it's really a developmental disability or whether the psychiatric diagnosis is really the primary diagnosis. So it becomes a little bit more complex the more complex the individual is and presents.
And I know we're running out of time, Michelle and Matthew, thank you so much for your time in doing this and explaining all this. Just one last question. If, let's say someone is approved and deemed eligible, what can the family or individual expect? Is there do they get informed and then it's up to them to seek their own services, or are they automatically assigned someone? How does that work?
Well, once the individual is determined eligible, they'll get paperwork from OPWDD. They'll be given the care coordination choice list. If they've used a care coordination organization to assist them with eligibility, a lot of times individuals will just continue with that organization with care management, but they do have the option of choosing any of the 4 providers of care management that cover Westchester. So they would connect with a care manager and then explore, what services and supports are available. The care manager can then assist with if, they are looking for housing or for community rehabilitation, whatever service they would then, the care manager would have to assist them apply for a home and community-based waiver. That's another application, but certainly the care managers can assist with that. So really next step after eligibility, I would say, would be choosing a care coordination organization.
Great. And there was a question in the chat about SSI of whether or not will receiving or not receiving SSI play a factor in the approval of eligibility?
It doesn't affect approval of eligibility, but with regards to housing, we've had some individuals who became OPWDD eligible while they were residing in a homeless shelter, but without having Social Security benefits, they weren't approved for housing subsidy because they had no income to be able to pay their portion of the monthly rental supports and for their needs. But that doesn't mean that the care manager shouldn't be assisting that individual apply for all benefits and entitlements that they could possibly be eligible for. Whether it be Social Security is a big one, but also for, food stamps and for, Section 8 or, whatever services and supports that someone needs. So no to the, SSI does not play a factor.
But if they are getting SSI, if I'm a case manager and I know that the client is receiving SSI, often we don't know exactly what the condition is why the person's getting SSI.
Mm-hmm.
Could that possibly lead to a trail that may have paperwork in terms of their intellectual developmental disability status?
Well, they would have had to have shown at some point some kind of documentation to the Social Security office that would have then in turn deemed them eligible for SSI. So there had to have been some documentation showing what the disability was. That's something that can be requested from Social Security. I know it's a little, sometimes it's difficult to get, but, we often have found individuals who are in the homeless shelter system don't necessarily have documentation with them from when they were, younger. If they're over 22, chances of them having that, qualifying documentation is pretty slim. So we have to it needs to kind of be pieced together at that point. But there are services and providers that can help.
Yeah, so I think that's the thing, is reach out for help if you guys need assistance in figuring some of this stuff out, because it can be very complicated and challenging. But just like all good caseworkers, we have to follow every crumb, right? If we can try to follow a crumb to a string of information or documentation anywhere that we can, that makes sense to do. So,
and we're more than, Matthew and I are both more than willing to talk through a case. If you can't share name and, we can talk hypothetically and where you can go, moving forward to assist the individual that you're working with. So we're here.
Great. Thank you both very much. I don't know if Jenny, did you want to close out?
Yes, thank you everyone for attending this training. We'll be posting it to our COC website after this, and you guys will also get the handouts as well as the slides after.
Thank you, Jenny, for pulling this together.
Thank you.